Okay, let's dive right in. You know that feeling? Maybe a nagging cough that just won't quit, or perhaps you're grappling with a new diagnosis.
Hmm,
Where do you go? Clinic, specialist. It's a dilemma we all face, right?
absolutely. And it's easy to get it wrong. People sometimes rush to the ER for minor things.
Right, or they delay seeing the right expert, which can cause its own problems.
It's a really critical decision point in your health journey. Making that choice wisely can save, well, a lot. Time, money, worry.
Exactly. So that's what this deep dive is all about. We've looked at some really solid sources to help you figure this out.
Hmm.
We've got insights from Joint Commission International, they're global, focused on quality and safety, and NABH, the National Accreditation Board, doing vital work here too.
Good standards to look at.
Yeah. And we've also tapped into Supremedic, their healthcare consultants, plus HospiMatch, which is a resource for healthcare info, and a guide called Lifelines, Clinic versus Specialist. Pretty straightforward title on that one.
It's interesting how these different perspectives all kind of point towards similar practical advice, isn't it? Navigating the system.
It really is. So our mission today, to just cut through that confusion, give you a clear picture. When is a clinic your best bet? And when should you think about a specialist directly?
The aim is for you, the listener, to feel empowered, right? Make informed choices, feel confident, and not get overwhelmed by it all.
Definitely. So let's start with the basics. A basic clinic, what exactly is that?
Think of it as your first port of call for everyday health stuff. It's usually the front line, where you go first for non-emergency issues.
Okay. And who works there? Who are you likely to see?
Typically, you'll find general practitioners, GPs, or family doctors. These are doctors with broad training, good at diagnosing and treating a really wide range of common problems.
Right. So what kind of things can you actually get done at a clinic? What services do they offer?
Well, it covers a lot of the routine stuff, your regular checkups, annual physicals, keeping track of your health.
Vaccinations, too.
Oh, yeah, standard vaccinations, immunizations,
Hmm.
and then treatment for minor things, colds, flu, maybe a mild skin infection, that sort of thing. Minor injuries, like a small cut needing a stitch.
Okay.
They can also do some basic tests, blood pressure, checking blood sugar levels, and importantly, renewing prescriptions for common stable conditions.
I remember that Lifeline's guide called Clinics the Gatekeepers of Health. That seems about right.
It does resonate, yeah. They assess you, treat you if they can, or point you in the right direction if you need something more specialized.
And it said something like 80 to 90% of everyday health issues can be handled there.
That's what the guide suggested, yeah.
Yeah.
It really shows how crucial they are for the whole system to work properly. Keeps things flowing.
Okay, so that's the clinic. Now let's switch over to specialists. What makes them different from a GP?
The big difference is the extra training. After general medical school, specialists spend several more years focusing intensely on one specific area of medicine, like a cardiologist for the heart, a neurologist for the brain and nerves, a dermatologist for skin. They go really deep into that one field. It's very focused expertise.
So when should you actually seek out a specialist? What are the triggers?
Several key situations. Probably the most common is getting a referral from your GP.
Okay.
If your main doctor thinks your issue needs that deeper knowledge, they'll send you to one. Another reason is if you have symptoms that are severe or they just aren't getting better with your GP's care.
Persistent problems.
Exactly. And finally, if you already have a diagnosed condition, something complex that needs ongoing, specific management like, say, chronic heart disease or a neurological disorder, you'll likely be under a specialist's care already.
That Lifelines guide warned about just picking a specialist yourself without really knowing, didn't it? Why is that tricky?
Well, it might seem faster, going straight to the expert, but if you pick the wrong type of specialist for your issue, you could end up doing extra tests, maybe tests you already had. It costs more, and it can actually delay getting the right diagnosis and the right treatment. A bit counterintuitive, maybe?
No, that makes total sense. So digging into that a bit more, why can't basic clinics just offer that specialist level care? What are the limitations?
Well, a major one is the equipment. Highly specialized gear.
Like what?
Things like MRI machines, CT scanners, really advanced X-ray setups. These are needed for diagnosing complex internal issues, like certain tumors or tricky fractures. They're incredibly expensive, need special staff, just not practical for most general clinics.
Right. The Supremedic info pointed that out too, that this tech is usually in bigger hospitals.
Exactly. And it's not just the big imaging machines.
What else?
Specialized lab tests, too. Things like biopsies that need complex analysis or very specific blood work a specialist might need. Basic clinics usually don't have the setup for that level of lab work.
So there's the equipment gap,
Yeah.
and then there's the difference in training, right?
Precisely. Like we said, GPs have broad knowledge for common things. Specialists have spent years honing in on one area. That depth allows for much more precise diagnosis and advanced treatment for complex stuff within their field. The Lifelines Guide really stressed that difference in knowledge scope.
Okay, equipment, expertise.
Yeah,
What about just the capacity to treat complex, ongoing conditions?
that's the other piece. Clinics are great for prescribing common meds and handling acute short-term illnesses, but managing serious long-term conditions often needs more.
Like diabetes or heart issues you mentioned?
Yeah, conditions like poorly controlled diabetes, complex heart problems, neurological disorders, they often need regular monitoring by specialists, maybe specialized drugs, maybe even procedures. That's typically beyond what a basic clinic is set up for.
Okay, this is really clarifying things. So based on all this, let's get really practical for the listener. When should you head to the clinic? Give us the list.
Generally, the clinic is your go-to for common stuff.
Yeah.
So fever, cold, cough, sore throat, the usual suspect. Mild stomach issues, vomiting, diarrhea, bit of stomach pain, headaches, general aches and pains, backache. Start at the clinic.
Minor injuries, too. Cuts, scrapes.
Yeah, small cuts, minor skin issues. If you think you might have a seasonal bug, like the flu, or maybe even mild dengue, the clinic's a good first step.
And routine stuff.
Absolutely. Blood pressure checks, blood sugar checks if you need them, getting regular prescriptions refilled if your condition is stable, and just your general annual checkup. Clinic's the place.
Got it. That's pretty clear for the clinic side. Now, when is it appropriate to think about going straight to a specialist, or at least asking about one?
Okay, direct to specialist. Consider it if you already have a diagnosed chronic condition and you're supposed to be seeing that specialist regularly, like epilepsy or severe asthma, maybe an autoimmune disease.
Right, ongoing care.
Exactly. Also, if you get new symptoms that seem really specific to one organ system and they're worrying like blood in your urine, sudden vision loss, chest pain that won't quit, that might warrant seeing a specialist sooner rather than later.
Makes sense.
And obviously, if your GP explicitly tells you to see a specialist, you follow that referral. That's straightforward.
And what if the clinic visits aren't helping?
Right. If you've been to the clinic once, maybe twice for the same issue, and you're just not getting better, that's probably a good time to discuss with your GP whether seeing a specialist is the next logical step.
Okay, so we've covered clinics, specialists. What about hospitals? Where do they fit into this picture, along with super specialists?
Hospitals and super specialists are really for the complex, the critical, the serious stuff.
Like
Dealing with conditions that affect multiple body systems at once. Surgery obviously happens in hospitals, emergencies, that's the ER.
Yeah.
Intensive care, ICU care, that's hospital-based.
and complex diagnoses.
Yes, getting second opinions for really serious diagnoses or needing those super advanced diagnostic tests we talked about, that often requires a hospital setting.
But it's key to know what hospitals aren't for, isn't it? We don't want to clog them up unnecessarily.
Absolutely crucial. Hospitals, especially ERs, shouldn't be the default for things a clinic can handle easily. Mild fever and cough, routine checkup, a small cut, or a minor sprain. Probably not a hospital visit.
So they don't replace the clinic as that first stop.
Definitely not.
Yeah.
The system works best when clinics handle that primary care role effectively.
Okay, so putting it all together, what does a smart healthcare journey look like for someone trying to navigate this?
Well, ideally, it starts with having a regular GP or family doctor at a clinic. Build that relationship for your general health needs.
And listen to them about referrals.
Yes, follow their advice on referrals. They see the bigger picture of your health. Also, try to keep track of your symptoms yourself. Keep your medical reports organized if you can.
Be an active participant.
Exactly. And only seek specialist care when it's really needed, based on a referral or those specific concerning symptoms we mentioned. Having that consistent GP who knows your history really helps with continuity of care.
That sounds like a good roadmap. Are there any specific things families or people caring for older relatives should keep in mind?
Yeah, a couple of things. For families, having one go-to GP for everyone can be really helpful.
Yeah.
You get coordinated care, the doctor understands the family context, and maybe designating one person in the family to sort of manage appointments and keep track of medical info can prevent things from slipping through the cracks.
Good idea. And for older people.
It's really important not to just dismiss new symptoms as, oh, it's just old age. Their health can be more complex, so timely checkups and paying attention to changes are really key. Don't delay seeking
Oh,
advice.
don't just brush it off. Okay, so as we wrap up this deep dive, what are the main things you want people to take away?
I think the core message is understanding those distinct roles. Clinics are your home base for routine care. Common illness is your first stop, often your only stop needed.
And specialists.
Specialists bring that deep expertise and advanced resources for the more complex, specific health challenges. Knowing when to go where, that really makes your healthcare journey smoother, more effective.
And maybe a final thought for our listener to chew on.
Yeah, maybe think about your primary care doctor, your GP, as a real partner in managing your health. If you understand the system clinics, specialists, hospitals, you can work with them to make informed choices. Better than just reacting or making rush decisions, right?
Absolutely. Maybe take a moment to think if your current approach lines up with what we've talked about today.
And, we mentioned Supremedic earlier. It's worth remembering that organizations like that are working behind the scenes too, helping to build and support the healthcare infrastructure that allows this kind of tiered care system to actually function. It all fits together.